Capital Views is sponsored by Northrim Bank, Alaska Oil and Gas Association, ConocoPhillips, and Linden.
Hi, I'm Tim Bradner with the Alaska Legislative Digest, and thanks for joining us today at Capitol Views. And today, a special thanks to Jared Kosin, the President and CEO of the Alaska Healthcare and Hospital Association, or did I turn that around, Jared?
The Alaska Hospital and Healthcare Association.
Okay. Okay, thanks for correcting me. And Jared, um, medical care, the cost of medical care, the quality, everything that's really front and center for a lot of Alaskans these days. What's kind of on your plate? What's the healthcare industry concerned about these days?
Yeah. Well, first, I want to say thank you, Tim, for having me. I really enjoy seeing with you and talking with you. When I think of Alaska healthcare right now and kind of what's top of mind, you talk about the cost of care. There's so many contributing factors, and on my plate, as I kind of look at this, workforce continues to jump out as an issue. We've looked at that and talked about it for years, but I think there's a lot of information there. I also think insurance offers an opportunity. I mean, we're seeing this nationally with obviously the events that played out in New York and the public sentiment. We have a broken system. I think there's opportunities to address that in a productive, collaborative way. And there's other factors that we experience that we're kind of calling gridlock in healthcare, where our system's just not functioning the way it's supposed to. And that, along with many other things, is kind of what's driving up the cost of care for a lot of Alaskans. So we are looking at a pretty large plate of issues, going into 2025, all of which are complex but need attention.
Well, hopefully, somebody in the legislature will pick up on this and pay some attention to it and develop the expertise. I know that it's such a complicated area that it's difficult. I can think of only one or just a handful of legislators that really have got the background on to sort of get their minds around these kind of issues. Um, what do you, what's what's the labor situation like right now? Do we
Yeah.
still have a nurse shortage?
We do. When we look at, we just actually released our fourth edition of our Alaska healthcare workforce analysis, which is great. Once you have 4 years of data, you can start to develop trends and kind of see different aspects of what it's like to be working in healthcare here. I see it in three different ways. Number one, healthcare continues to be a critical employer in Alaska. We're paying out 13% of all healthcare, of all workforce earnings in the state, and we account for over 44,000 jobs. With that, there are opportunities right now for Alaskans to come in and enter the workforce. This kind of gets at that shortage question you were talking about. Every year, we have to hire over 9,000 new employees to make up for churn and growth in our industry. And within that, we have some of the highest growth occupations in healthcare for the entire state. So we feel like, we have these shortages and we still have these opportunities, and healthcare continues to be a really strong employer. But there is that ongoing struggle. Yes, Alaska is still projected to lead the nation in nursing vacancies by 2030. And our schools and technical programs just can't keep up with the demand we have in state. So there's just a variety of flavors there with what's going on in our state, from the strength of employment to opportunities to that kind of ongoing struggle.
And Jared, we make up the nurse shortage by importing nurses, the so-called traveling nurses, and these are very expensive. Do you have a sense of how much more
Yeah,
expensive, how much they add
we
to the cost of healthcare?
sorry, no, that's a good point. And that's not always the case. It's not always, we're not able to kind of solve everything through importing. I think what my takeaway would be on this would be workforce strategies, the work we have been doing, the work Alaska's hospitals, nursing homes, and other providers have been doing. Those are long-term strategies that are going to take years to play out. So you are right. I mean, we have to be attractive to people from out of state to come in and be here, but that's just one piece of it. So I think the workforce issue continues to be both a challenge and opportunity. And I think what else kind of comes to mind with this is looking at what are other ways we can kind of address some of the challenges in the healthcare system. And that's kind of going back to what I started with is insurance. Is there something we can do in that space? And I think there is, something that we are focusing on because we hear it from patients every day is kind of how broken prior authorization is. And that's a process that is used by insurers to review the appropriateness of care. But really what it has kind of developed into is a lot of undue delay for patients who need care and treatment, prescription drugs, things like that. And what I feel like is kind of, I guess, uplifting in this is there's an opportunity to work together, between providers, the payers, the insurers, even the state of Alaska, and look at how do you take a complex problem like that, which, had I think well-meaning intent, for a long time. It's just not working. And how do you address that and reform it and fix it? And I'm very optimistic through that kind of collaboration and effort. I think we're going to be able to find a lot of good reforms out there to work collaboratively with all those stakeholders and the legislature.
Wait, Jared, what sort of procedures are we hearing the most complaints about on prior authorization?
Yeah,
Um,
yeah, sorry, Tim.
I'm hearing that even very routine procedures are now requiring substantial delays, insurance companies in approving the treatments.
Yeah, it's widespread. And that's the thing with healthcare. When we have these conversations, uh, we could spend 2 hours and talking about that and kind of parsing through what procedures are hit most, why is it happening, where does it make sense, where does it not make sense. I think the bottom line and the kind of broader takeaway is there's too many stories of patients who are having their care interrupted by a bureaucratic process and paperwork. There's too many instances where providers who are in the position to make medical decisions with their patients are basically prevented from doing that because of bureaucratic processes and certain stipulations from the insurance companies. But that's all to say that I think there's opportunities to really address that. And I have to say, I'm obviously very optimistic. We've done a lot of work with the insurers over the past couple months that I think we can really come up with some solutions and advance them forward.
Well, that's encouraging. One of the things that has always struck me about this too is how much time a physician, a provider has to
Yeah.
spend haggling with on the phone with an insurance company and trying to get approval for the procedure for their patient. And that's I mean, that's got to be a real driver in the cost of healthcare.
There's no doubt it is, and that's what I'm saying is, sometimes we all try and go about these issues in our own ways and try and solve them. At the end of the day, healthcare is complex and it overlaps across many provider types and many places of care. And so I think the real path to success is bringing everyone together and trying to figure out how do we address everyone's needs, not in a way where we're all kind of get exactly what we think we want and what we think the system should look like, but really progress on the system as it exists today. And that's one area that needs to be addressed. Providers are really busy. We already have limits to access where Alaskans can't get access to healthcare. Part of which is because we don't have enough providers, or the providers have too much demand on them. And so you're absolutely right, Tim, and that is a very real concern that hopefully we're able to make some progress on.
Well, I hope so. 2025 is another year. Hopefully there'll be progress. Jared, thanks very much for joining us.
Yeah, thank you, Tim. Look forward to talking again soon.
Thanks. Thanks. This is Tim Bradner with Legislative Digest. Thank you for being with us.